Hello, everybody, and once again, welcome to the Compass One podcast series here at the Vizient Summit Connection Summit. We've had a great day full of podcasts. It has just been a wonderful experience being up here learning so much on my dock is what I like to call this, is my dock. My name is Tommy Kane, and I'll be hosting this podcast as well. And I got two awesome ladies with me today that we're going to be discussing harmonizing healthcare to support clinical caregivers. And to do that today, I'd like to introduce you to, first off, this is Sophia McCrae. Sophia is the Vice President of Standardization, Innovation, and Experience. She is responsible for the patient experience strategy, standard operating procedures, housekeeping innovation, and helping our teams align operations to support better outcomes for our partners and patients. Sophia, thank you for being here today.
Thank you for having me.
Of course, of course. And now next to her is Miss Aundrea Mills. Aundrea is the Chief Nursing Officer for Compass One Healthcare and leads their nursing engagement strategy and activation. Aundrea has been working in hospitals her entire career and is a true believer in the power of improving patient satisfaction outcomes by prioritizing the caregiver experience. Aundrea, thank you for being here today.
Thank you. Thank you.
You know, we're sitting up here on this nice dock. We got the lake behind us. I think the only thing we're missing is a margarita.
Spicy, to be specific.
Spicy margarita.
It's 5 o'clock somewhere.
It's 5 o'clock back on the East Coast. It's past 5 o'clock. So we have to talk to management about getting some margaritas up here. Let's jump right into it. Aundrea, what are the current issues facing nursing in the hospitals? I mean, I know there's so many issues, especially after the COVID world we went through and everything like that. But what are they facing these days?
I think really, unfortunately, we have what I would call a perfect storm. Really, we have so many nurses, candidates that want to go into nursing school, yet they're turned away because we don't have the educators. So that's one part of it. And then in the next 10 years, we project 4 million nurses to retire. And then let's look at the current state. Post-pandemic, we have a focus on work-life balance more than ever.
Right.
And nurses are no different. So they're seeking opportunity outside the hospital. So now more than ever, it's most important that we focus on how we can support our nurses.
Aundrea, I got to follow up on that. Like, I have to imagine that after the pandemic, that was probably even harder to get nursing people to go into nursing after what they saw on the news about what the nurses were going through. Is that accurate?
It's very accurate. Yeah. It's very accurate. I was working in the pandemic with those nurses, and it's very true. And stress being the dominant health hazard for nurses, the number one reason for burnout.
Yeah.
So again, back to what we can do to support them is most important. So it's very real. The stress that leads to the burnout. Yeah.
How do you help our partners support clinical caregivers?
I think really it's threefold. And myself, my team, we look at it in three directions. You know, we have to listen to the nurses.
Yeah.
We have to care for them. And believe it or not, we have to work for them. And what that looks like can be very unique. We know that hospital CEOs still, one of the top 3 concerns that keeps them up at night is the caregiver wellness and safety. And so prioritizing that is most important to us. Listening to the nurses, we can listen, we have to act, but we have to keep listening. Mm-hmm. And leveraging technology, resources that we have to hear directly from them and how we can support them in our support services is most important. And then lastly, work for the nurses. I think about our dynamic patient transport teams and our patient ops teams. You know, those are roles that nurses are taking on when those roles aren't there. So preventing them from practicing at top of license. Mm. So that's an example of how we can work for them. So really those 3 categories, listening, continuing to listen, act on what we hear, and then supporting them, and then working for them in ways like support services can do.
Yeah. Sophia, from your standpoint, what are the pain points that you've uncovered?
Oh, absolutely. So it's an honor and privilege to be here with Aundrea, and we have the pleasure from an operations perspective of learning through her and from her. But through the pandemic, we entered into exclusive strategic partnerships with not only Press Ganey, but the American Nurses Association. Right. So we could really dig into what a day in the life looks like for a nurse from an operations perspective. So as Aundrea mentioned, we know that 79% of nurses experience some level of stress. So to really dig deeper there, we understand that they have stressors around lifting and positioning patients, which could be quite a burden to them. Outside of that, there are sharp injuries that are not often communicated. There's prolonged standing, which is a concern of theirs. So how do we understand that? They contribute to 1 to 4 hours of non-clinical work. So as support services, we want to alleviate those stressors and be there for them so that they could, as Aundrea mentioned, practice at top of license.
Yeah.
So there are various ways we can accomplish that, whether it's through task management systems, efficient throughput methods, and just a variety of things to really alleviate stressors from them. It's a passion of ours, and I look forward to continuing that work with Aundrea.
Yeah. I mean, it really is fair to say that the nurses are the backbone of a hospital. Is that correct?
It's very correct.
Yeah.
The backbone, and really, when you look at percentages, at 75% of the workforce in any hospital are nurses.
Yeah. Good stuff. You mentioned technology earlier. Let's talk a little bit about what the role in technology in driving service line collaboration and providing a better experience for nurses. How is technology helping that, and what do you see maybe down the road?
So, that goes back to the listening. They have ideas and we have to listen. When we think about technology, I think about some of our resources through our My Dining platform, TaskView. So rather than a nurse on the phone trying to find an answer or a solution to an issue or even wait times, the technology in our My Dining platform called TaskView allows nurses to just at a glance look to see where the meal is in the spectrum. And again, that's giving them time back, which is the most precious resource they have.
Time.
That's right.
Yeah. What do you say about that, though, Sophia? I mean, as far as just like seeing what you see and all with the relationship with Press Ganey and kind of getting the feedback from the hospitals. But how important is that time, and what does that really mean? Like, even though it's a couple minutes for a nurse to not have to spend so much time doing something, how beneficial is that?
Oh, it's critically important, especially for just workflow optimization and patient throughput. And understanding what patients experience from a technology perspective, it's important to note that 70% of patients do want technology to be a part of that care. So we're in the best position to give that back to nurses by providing technology systems that will allow for our processes to be more efficient, whether it's through task management, anything to impact throughput. I know we do a great job of monitoring clean times, but dispatch times as well as response times are as critically important. So communicating those data points so we could see a seamless throughput process is critically important.
Yeah.
Yeah, we were go ahead.
Yeah, she mentioned turnaround times and how important that is. You think about our emergency departments and the boarding of the patients and how important it is for us with our EVS teams to be on top of that turnaround time. And, again, supporting the caregivers.
Yeah. We were talking about technology in one of the earlier podcasts, and I found it fascinating with the fact that, in a lot of our hospitals, when a room's clean, boom, they can put it right away in the iPad. Everybody knows. And it cuts down on the wait time for the patients to get a room. It cuts down on the food being serviced, knowing when the patient's coming to the room and all that stuff. And it's kind of really powerful for the whole hospital as much as possible to be on that same page and to all be like, okay, now we know where we are, whatever. And there's the communication. I think it's pretty fascinating. Do you see that something that's going to...
It is. Yeah. And it eliminates phone calls, redundant phone calls, and it's everyone at a glance has the same access to that information. So important.
Yeah.
Yeah, and it's creating feedback mechanisms that are continuous and part of our day-to-day operation is really important for our partnerships. We have a partnership with My Rounding. They're also known as Huron Rounding, and to date, we've interviewed and have partnered with 93,000 nurses, capturing their feedback on timeliness of meal delivery, their satisfaction with the great employee that we have on their units, and just various methods of communicating. I think it's worked quite well, and thanks to Aundrea and her team, we take that feedback and make it actionable at the site level.
Yeah, I'm glad you brought that up. We, hearing directly from the nurses and the unique needs, and, maybe it's a facility, a system, or even a unit, and applying those unique needs to action items. We saw in one case study in a health system, in a 6-month study, we improved nurse satisfaction around the patient dining 17% in just 6 months by listening to them, applying their recommendations.
That's huge.
It is. And then from an EVS perspective, we improved the The EVS response time, 15% increase in nurse satisfaction.
Huge.
So listening to them, applying the actions, and then, of course, continuing that is most important, the follow-up.
I agree.
And I think all these successes are great, but I think ultimately, too, one of the great things is that the nurses know they're being heard,
That's right.
which makes them, I'm sure, feel more important and feel like, okay, I'm not just out here busting my butt and nobody's hearing what I'm saying.
Strengthens the relationships.
Yeah, exactly, which makes the better work across.
sure does.
Yeah, there you go. Okay. This has been great. Where do you kind of see the future? Let's talk a little bit about the future of where we're going with all this and what. And the technology starting now, talked about the technology, what is helping with the nurses, but what do you see maybe down the road as far as where we might be going with all this?
Again, back to listening to the nurses, they're gonna bring ideas to us.
Yeah, because they
what
know
works.
best, right?
That's right. They know best.
Right.
I think as we listen to them, as a matter of fact, listening to them, we've mentioned TaxView a couple times around phone calls. That's exactly where that came from. It's just applying what we hear from them. I think it's going to grow. We know we're in the world of AI, just applying best practices from what we even learned from some of our sister hospitals. But we can't be closed-minded to the way we've always done it. And I think that's what's most important is
Yes.
we have to evolve and not be afraid of risk.
Yeah, Sophia, I'm interested in your thought on that.
Yeah, it's funny you mentioned AI. I mean, we're in a state where ChatGPT is able to
Right.
test for HAI. I mean, we can diagnose based on AI. So if we could be more predictive, leveraging analytics to help diagnose problems for patients, then the longevity of their health would be of benefit. But outside of that, I think there are so many cross-training opportunities. If we know that 1 to 4 hours are focused on non-clinical tasks, our associates are in the best position to elevate themselves to that of an infection prevention specialist and just gain skills that we haven't exposed them to so that they could be a better provider to nurses. So I think cross-training and leveraging technology where it plays a role in the continuum of care would be fantastic. Outside of that, we've ventured on an opportunity around experience mapping. And it's something we've learned from Chick-fil-A, where they've designed these awesome parking lots, and they just constantly watch the throughput process to ensure it's efficient.
Right.
So if we can balance efficiency with safety by putting the nurses at the center of strategic planning, then we'll co-design what the future of healthcare could look like with support services and clinical teams.
It's interesting how it just always comes back to Chick-fil-A, right?
I mean, can't go wrong with chicken nuggets and French fries.
Oh, no.
If you had to give one piece of advice to a health system, Aundrea, that was to help nurses, where would you suggest they start? And I know I think I know what you're going to say. Listen, right?
Yeah, listen, but listen to understand, not just to listen.
Okay.
Listen to understand, and then don't stop listening. Just because they bring innovation or ideas, having a routine cadence in which we hear from them, have feedback, it works, it may not work, whatever that looks like, but just don't stop. Just don't stop.
Yeah. Sophia?
Oh man, I have to shout this fantastic team out. The U of L team in Kentucky. We
Okay.
have a unit director of EVS. His name is Shannon. And he, alongside the clinical and safety teams, have contributed to an 18 to 24% reduction in HAIs. And that's with everyone owning the environment. So we've elevated the role of our housekeepers. And now we're monitoring alongside our clients hand hygiene practices, surface measurement testing like you can't imagine to keep people safe. I mean, 1 in 31 patients get an HAI at any given time. So the fact that we're collaborating to make the world safer, healthier for those that we serve is just the future of where we want to go to really serve the best people out there.
Yeah.
That's incredible, and I'm glad you brought that up. We mentioned Press Ganey in our partnership. We look at engagement, employee engagement. Nurses, the facilities that have the top decile of engagement show. Even as late, I looked at some data this morning that talked about a 33% improvement in likelihood to recommend for those facilities that had the top decile of nurse engagement. And I mean, the outcomes, you mentioned those safety outcomes, they come hand in hand with the nurse engagement. So I think the work that we're doing to partner with our nurses is so powerful. We're only as good as we are together.
I agree.
Yeah. Great stuff. Great stuff. Thank you both for joining me up here on the dock.
Thank you.
This has been a great and very insightful conversation. And on behalf of all the nurses out there, I'm sure they would like to thank you as well for everything you're doing and making their life easier. But thank you both for joining us today. And I'll let you go and you can go get your margarita, your spicy
I'm
margarita.
ready for it.
Spicy.
Thank you, Tommy.
Thank you.
You're welcome.
so
Thank you,
much.
ladies.
Bye.